Joint hypermobility is a condition where the joints can move beyond their normal range of motion. It can occur in isolated joints or be part of a broader condition known as joint hypermobility syndrome (JHS) or as part of more complex disorders such as Ehlers-Danlos syndrome (EDS). Here's an overview of joint hypermobility, its causes, symptoms, diagnosis, and management. Causes: joint hypermobility can arise from several factors. Genetic factors. Inherited conditions. Joint hypermobility can be hereditary, often seen in conditions like Ehlers-Danlos syndrome or Marfan syndrome. Structural factors. Loose ligaments. Some individuals have ligaments that are more elastic or less taut than usual. Collagen abnormalities. Connective tissue disorders. Conditions affecting collagen or other connective tissues can lead to increased joint flexibility. Developmental factors. Joint laxity. Children may have more flexible joints, which can sometimes improve with age. Symptoms. Symptoms of joint hypermobility may include increased range of motion, excessive flexibility. Joints can move beyond the typical range of motion without dislocation. Joint pain. Discomfort. Pain or discomfort in joints, especially after extended use. Joint instability. Frequent sprains. Joints may feel unstable, leading to frequent sprains or strains. Muscle fatigue. Increased strain. Muscles around hypermobile joints may experience increased strain, leading to fatigue. Increased risk of injuries. Frequent injuries. Increased likelihood of joint injuries or dislocations. Symptoms in other tissues. Skin elasticity. Skin may be unusually stretchy or fragile. Blood vessel fragility. In some cases, blood vessels may be more prone to bruising. Diagnosis. Diagnosing joint hypermobility typically involves medical history and physical examination. Discussion. Reviewing symptoms, family history, and any associated conditions. Examination. Assessing joint flexibility and range of motion. Beaten score. Assessment tool. A commonly used scoring system to evaluate joint hypermobility based on the ability to perform certain movements, such as touching the floor with straight legs or bending the thumb back to the forearm. Genetic testing. For genetic conditions, if a connective tissue disorder is suspected, genetic testing may be conducted. Imaging studies. To rule out other conditions, X-rays or MRIs may be used to assess joint structures and rule out other issues. Treatment and management. Management of joint hypermobility focuses on alleviating symptoms and preventing complications. Physical therapy. Strengthening exercises to build muscle strength around hypermobile joints and improve stability. Joint protection techniques to prevent injuries and manage joint pain. Pain management. Medications, non-steroidal anti-inflammatory drugs and SAIDs or other pain relief medications may be used. Heat or cold therapy. Applying heat or cold to affected joints to reduce pain and inflammation. Lifestyle adjustments. Avoiding excessive stress. Avoiding activities that put excessive stress on hypermobile joints. Proper ergonomics. Adopting ergonomic practices to reduce joint strain. Assistive devices. Braces or supports to provide additional support to hypermobile joints and prevent injuries. Education and awareness. Self-care. Educating patients about self-care strategies and proper joint protection techniques. Treatment for associated conditions. Managing underlying conditions. Treating associated conditions such as Ehlers-Danlos syndrome or other connective tissue disorders. Prevention. Preventing complications related to joint hypermobility involves regular exercise, engaging in low-impact exercises that strengthen muscles without straining the joints. Healthy lifestyle, maintaining a balanced diet and staying active to support overall joint health. Monitoring symptoms. Regular check-ups with healthcare providers to manage symptoms and address any issues promptly. Conclusion. Joint hypermobility can vary from a benign trait to a significant health concern, depending on the severity and associated symptoms. While it is often manageable with appropriate treatment and lifestyle adjustments, it's important to consult with a healthcare provider for an accurate diagnosis and tailored management plan. Addressing joint hypermobility early can help prevent complications and improve overall quality of life.